Welcome to the Brain Health Hookup. I'm Laurel Myers Hurst, your resident groovologist, and I believe that better mental health needs to be fun. Here we talk about mental wellness, we explore the physical, emotional, and relational needs we have as humans with the science and practices that help our mental health to flourish. Plus, we dive into my signature method, groove therapy, that engages folks in groove-based music making to lift mood and lower inflammation and pain. I'm so glad you're here. So let's hit it. Well. That's a deep subject. Today, I'm going to address the most frequently asked question I get as a psychiatric mental health nurse practitioner who specializes in integrative care. That is the question, how do I know when I'm ready to get off my psychiatric medication? This question has a few key elements. It's not that complicated, but it's a little different from other questions we could ask, like what constitutes a failed medical trial? How do I know if I'm on the right medication? But the question, how do I know when I'm ready to get off my psychiatric medication, comes to me a lot because my patients know that I have more than just medication in my tool bag to help them feel better. So we talked in another episode about the Diagnostic and Statistical Manual of Mental Disorders. That is the guide, the symptom menu, as it were, for any diagnosable disorder in the United States. Other countries actually have different disorder lists and different symptom lists. So this is our guide for the United States, which we use for the purposes of treatment and insurance. When people come to me with this question, am I ready to get off psychiatric medication? My very first question to them, well, before I get to that, I want to remind you that while I am a psychiatric nurse practitioner, I'm not your psychiatric nurse practitioner. So everything I say today is just general information and knowledge. You can fact check what I'm saying on the internet at large, but this is not intended to treat you or to recommend whether you do or do not continue medication. That is a conversation with your healthcare provider. So the first question I respond to them with is, are you truly in remission? Remission means mild to no symptoms, nominal symptoms. Even if that remission is supported by medication, psychotherapy, alternative treatments, or any of the above, are you at the point where you have mild to no symptoms? Meaning we can't tell you from someone else in the general population who wouldn't meet the criteria for a mental health disorder. If you're not in remission, speaking about getting off of your medication isn't even the conversation we're having yet, right? If your treatment hasn't been optimized and you're not in remission, and you're 6 months down the line, 18 months down the line, 10, 20, 30 years down the line, I cannot tell you how many patients come into my practice who have never understood what remission feels like. They have never been at the point of mild to no symptoms like the rest of the population from the first onset of their symptoms. Or if they had some point, maybe 3 or 7 years after the beginning of their diagnosis, a brief, maybe 1 or 2 year period when amazing and wonderful things happened to them and they had a time of remission. But they look back on that as something, it's just a dream that they could never achieve again. So if you're not in remission, you need follow-up care. The proof of the diagnosis is in the success of the treatment. So either you have not got the proper diagnosis or you don't have the proper treatment. But when you have the proper diagnosis and the proper treatment, coming into remission should be a real possibility. I'll talk in another episode about why so many people are not going into remission and the kinds of medications we offer as help that are put people in a quandary. I'll talk about that more in episode. Let me know if you want to hear that one soon. I'll record it sooner than later. But first question is, are you in remission on your current medication and treatment plan? Second question is, does the patient have the physical, emotional and relational resilience needed to remain in remission? That's a big set of questions, and a lot of assessment needs to be done on all levels. So physically, what does resilience mean? First of all, the ability to bounce back. So what happens in mental illness, usually something, a big stressor occurs, then you have a sick syndrome in your brain and nervous system health, along with how you think, feel, and act are all affected, and you don't bounce back. That's the very nature of a mental health disorder. When you have resilience, things may happen, you may have a low time, but it doesn't become a debilitatingly low time or a debilitatingly long duration of symptoms. So resilience is that ability to bounce back. When we're talking about physical, emotional, and relational resilience, we're talking about having the physical reserves to stay out of trouble when it comes to symptoms. That has a lot to do with the ubiquitous basics of mental health: sleep, nutrition, and movement. If we're not doing those things or aren't able to maintain them because our symptoms are so prevalent or so strong, then we need to think about fixing those before we move off of medication or moving to a different treatment plan, of course. Emotional resilience. Do we have the ability to be okay in ourselves? Are we still prone to panic attacks where we completely shut down, or we can't tell the difference between what we're experiencing in our bodies and a true heart attack? Maybe the feeling that we might die if this continues, and we have a feeling that it's emotionally related, but we don't have any assurance of that in our bodies. Our bodies say something serious is amiss. Emotional resilience, and you're appropriately tearful, meaning you're able to have the sentimentality and lament. You're able to feel those deep, darker emotions, and you're able to feel true joy and elation. If you don't have all of those emotional experiences in your emotional tool bag at this point, how can your treatment be adjusted so that you feel like a fully orbed human being? The third area of resilience is relational. If you feel like your relationship with your intimates, your spouse or partner, romantic partner or partners, is strained because of the way you think, feel, and act, relationship with children, parents, siblings, coworkers, are we able to experience what we have to share in common and grow and learn, change, adapt in those situations? That is true relational resilience. And if we don't have those things in place, taking medication away, just cold turkey, is not going to be an issue. Cold turkey is never a good idea, by the way. Almost all psychiatric medications have a rebound effect. So the way psychiatric medications work is often completely reorganizing the way your brain utilizes or organizes, pass through certain chemicals. And nothing is rebalanced in that process, by the way. But when we take that support away, we can go into a huge sense of shock in our nervous system by losing the kind of modulation that those medications provide. So that's a very real issue. On the physical front, let's go a little bit deeper into the physical front. Especially important for you physically to maintain your mental health by keeping inflammation low. If you haven't tested your inflammation, you can't know how your inflammation is doing. If you are tested for inflammation and find you have high inflammation and no one guides you forward to reduce it, that's also a problem that will hold up your remission with or without medication. So making sure you know what your inflammation numbers are and how to keep those low, not just lab normal low, but optimized low if you want your mental health to be optimal. Optimized nutrition. We've already talked about this in the whole realm of integrative psychiatric care. We look at the nutrients that feed the nerves: magnesium, phosphorus, iron, B vitamins, these things, and zinc. These things are crucial to our nerve health. And unless you know those vitamins are optimized, I wouldn't think about taking your medication away just yet. Then there are the things my friend Dr. Lee calls past painful experiences. Do we have the mind-body techniques in place to physically continue metabolizing and growing through our past painful experiences? I'll talk in another episode about the buckets of psychotherapy that I usually talk about with my patients. And again, if you want to hear about that sooner rather than later, just let me know. Respond to this episode and let me know, yes, I want to hear about the therapy buckets. But one of those buckets definitely is mind-body techniques, where we don't think ourselves to feeling better. We actually do something with our bodies to help us metabolize, to digest, to feed on and grow through those past painful experiences. So that isn't just about relationships and emotions. That's actually supporting your physical self, your neurological health that leads to mental wellness. So if you don't have those in place or don't even know what I'm talking about, we maybe need to have a talk before you think about going off your medication. Of course, all of these topics we work with and we work through in a supportive community in my course, The Well-Tuned Woman. If you'd like an invitation to The Well-Tuned Woman, let me know. I'm glad to extend that to you. We don't just talk about these things, we actually show how to find out about them, our personal status, and then what to do about it to take the next step to mental wellness. You can flourish. I know you can. This is the way, and I'm glad to share it with you. Take care. Thank you for tuning into this episode of the Brain Health Hookup. I hope this episode radiates with the conviction that generating mental wellness needs to be fun and safe. We want you to find your power and understand your innate design to flourish in everything you do. And we hope that inspires you to come back and listen for more. I'd love for you to leave a review of this podcast, as it helps this show grow to reach more people who need to make mental wellness fun. You can find the leave a review button, as well as all the YouTube visuals, bonuses, and ways we can help to support you on our website, podcast.grooveforhealth.com. I appreciate you more than words can say. See you next time, and remember, together we have everything we need.